Welcome back to The Verdict, MLMIC's podcast where we explore pivotal topics in medical professional liability insurance, healthcare law, and healthcare risk management. I'm your host, Tammie Smeltz. This year is truly a milestone for us at MLMIC as we celebrate our 50th anniversary of dedicated service to the New York healthcare community. We're honored to have you join us as we continue to bring you insights designed to support and inform your practice. Today, I have three amazing guests with me. Sheila Austin, President and Executive Director of Emmaus Ministries in Syracuse, and two MLMIC-insured dentists who graciously donate their time and services to the ministry, Dr. Streiff and Dr. Gerald Danaher. Hi, Sheila. Thank you for being a guest on The Verdict. Could you start by telling us a little bit about yourself and how the Emmaus Ministry came to be?
Hi, Tammie. Emmaus Ministry began back in 2009 as a parish outreach ministry from St. James Church, which is down on the south side in Syracuse, New York. And we had a new pastor that came to our parish and challenged our community to look for ways to reach out to the impoverished and to bring the presence of Christ to those outside of our walls. We were very good about taking care of each other in that little protected environment there. But the challenge of how do we do this in places that are uncomfortable for us or for people who we don't know and who are perhaps different from our backgrounds. So we started by making sandwiches and bringing the sandwiches to the Catholic Charities Men's Shelter, which is about 3 miles from the church. And that's where we started to learn about the challenges that people who live in the inner city, who are poor, living on the peripheries, what they have to endure. And we met with them. We got to know them, first name basis. We got to hear their stories and continue to build on that relationship, the additional components to our ministry, which was doing foot care at the shelter, providing greeting card ministry, doing haircuts, anything that the guests there did not have access to, we would bring to the shelter. Then we took that to another level and became mobile. We bought a van and loaded it with food and toiletries, personal clothing and such. And we traveled around the city, going underneath bridges. We would go out in encampments, found all the places that basically those men from the shelter would go during the day. And then we got to a point where we felt we wanted to have our own facility. We wanted to establish a relationship and a presence on the south side. So we incorporated as a 501c3 and we rented a building and had it renovated to be a place of hospitality where we could serve meals. We provided showers, laundry, food pantry, and items of need. That was back in 2017, and we outgrew that very quickly. We were fortunate enough to acquire a piece of property just around the corner, and we expanded that and moved into it in December of 2019, just before COVID. And we hit a spike of people in need as we were growing. And we went from 12,000 meals that first year to 34,000 meals in 2019. And during COVID, we focused primarily on feeding this community, which happens to be ranked number one in the country in child poverty. So it speaks to the needs that this community has. And during that COVID time, we talked to our guests further to find out what are the other things that they need in their lives. And they were all mentioning um, the need for more access to dental and medical care. So I went to a couple parishes in the Syracuse area and posed what I was hearing to be a concern of this particular zip code area. And did they agree that um, us creating a clinic would be good? You know, could we be providing the staff to do that? Were we duplicating services and such like that? So it was a consensus that we needed to have something on this side of town. The other free clinic was on the north side of the city. So we again were able to procure a building and renovated that. And in 2022, we opened up the dental component of the St. Mary Ann Cope Health Services. And the following year, we added the medical to it. And those people that we had brainstormed this with from a couple of parishes indeed became the backbone of our volunteer team. And that's where we are today, where I have the pleasure to be sitting with Dr. Streiff and Dr. Danaher as the key people who helped to establish the dental component of the clinic.
Wow, that is really quite the story, Sheila, and your mission has really evolved over time. I can't believe everything that you have, the time that you have dedicated and what you have achieved over the course of the years. I meant to ask you this before, the word guests. I love that you call the people that receive your services guests as opposed to patients. What made you decide on using that word?
Well, the whole ministry it's faith-based. We make no bones about that. We feel that this is a calling that God has had for us. And when we follow that plan, God provides exactly what we need in the timing that we need it. So they aren't patients to us. They are their family, and they're the root of our ministry. And if we provide dignity and value to each and every person that comes into this place, it's like they're coming into our home. So we call them guests. We refer to them as family and guests.
I really love that, Sheila. Now, today we're here to talk about the ministry's vital work in providing oral care. What exactly does that involve? And could you tell us more about the individuals you serve? And basically just talking like the dental guests at this point.
Sure. Tammie, thanks for having me. I'm excited to be here to talk about the great things that Emmaus is doing. As Sheila had said, as they were expanding and seeing a need for this, there's no doubt that the demand for services, for dental and medical services, far outweighs the supply that can be adequately provided. And it really is great to be a part of something like this and to give back to the community. There's a couple of community health centers in the area locally and hospital-based dental residencies that are really no longer accepting new patients. And because they're so overwhelmed, and it's a problem. And these guests, as we are saying, have so much value and worth as anybody. So to be able to provide that care to them, and not only dental, a lot of this mission is more than dentistry to me. It's about providing hope and inspiration and love and care and support to help these people go when they leave, go back out and feel like people do care. And teeth is just a way that we can get to them. At least as far as Dr. Danaher and I and the other core volunteers are concerned, it's just a way to get to know them better. In private practices and in our regular lives, we're always under pressure to meet certain expectations or be on schedule and always having other things to concern ourselves with and staffing and just all the regular world stuff. And here we can kind of take a breath and take our time with the guests and ask questions and really get to know them on that deeper level. And I can say, watching even the meal services in action, when the guests walk in, you can tell it's like they're walking into a family room in somebody's house, as if you were just walking home and you walk in and say hello to mom and dad and brother and sister. It's very informal. There's nothing uptight about it. And you just jump right into conversations and picking up where you had left off yesterday or last week or whatever. So to be able to be a part of this has really been great.
That's awesome. And I can just feel the fact that it creates a nice welcoming and home environment just by talking to the three of you. And it almost seems to me like you treat the guests as a whole. You're treating them as a whole person, not just their teeth or their medical care, but you're taking care of, as Sheila said earlier, their hair or maybe their feet, and you're providing them a meal and you're providing them friendship and love and somewhere to go. So it is like a 360 a holistic treatment of the guest. Now, regarding the dental care itself, is it just hygiene, or do you perform fillings for your guests? Do you do root canals for the guests? What does the actual dental care consist of?
Thanks for having us, Tammie. We do all sorts of restorative care, both composites and amalgam restorations. We do a lot of extractions. We do have hygiene. We also have root canals for anterior teeth, because we're of the opinion that if somebody smiles and they're missing a front tooth or an anterior tooth, it's going to be very negative towards them. So we always think of the patients first. That's the way I use Sheila's term guest, I guess. That the patients are the number one thing. And you're dealing with a guests who are very anxious. In other words, unfortunately, what happens, they usually come in when there's a really bad problem, and we have to take care of give them immediate care, and they're very nervous. And God bless them, that's one of the things we have to do. We have to calm them down so we can do the care, and then they usually say, I feel so much better. And that's the most rewarding thing for me. The fact that we see these patients and they feel so much better, and we know we're doing good for them. Now, I will tell you my story about my involvement here. I remember Dr. Streiff spoke at a county meeting about this, and a good friend, Mark Engel, a mutual friend of ours, he also said, this is a nice opportunity. Why don't you come to the meeting? Well, Sheila and Father John Mano spoke at the first meeting, and they talked about the poverty level in this area. And they also talked about different aspects of what they were trying to do. And so it really interested me. But the one thing I remember the most, I said, boy, I got to get involved with this. There was a veteran who came in here, used to come and eat. He didn't say much. He was a very shy man. And he eventually warmed up, and unfortunately, he passed away. Sheila and the folks here at the Emmaus Center had a funeral for the gentleman, And being a military veteran myself, this fellow was a military veteran. They were able to bury him with military honors. And I always said, this is where I want to be. I think this is a great organization. If I may speak personally to the dentists, the hygienists, and the dental assistants out there, this is a wonderful place to be. You're doing good to others. If volunteer, support the place. That's all I can ask them to do, because our job it's not a job, it's a gift. What we do is truly a gift from God. And I always believe that we have to give back to what we were given, the talent we were given. We always talk about time, treasures, and talents. Well, we have a talent, we should give it back to them.
I agree, Dr. Danaher. And what a great cause too. And it's always good to give back to the community. And it serves the community, but it also serves yourself too. It gives you a little sense of purpose and meaning in your life. Now, I know when we talked a few weeks ago, we were really focusing on getting volunteers. So I know you're seeking dental providers to volunteer sometime at the clinic. What does that entail exactly? Like how many hours does a dentist have to, are they committed to a certain amount of hours, or are there any specific parameters? And how would they get in touch with you to volunteer their time?
The number one thing is that I think is most important is you want to be here because you want to be, not because you feel like you have to be. And so, whatever you can give is what you can give. And you, we don't want to put people in a position where they're in a commitment that they end up regretting or feeling like it's an obligation. Obviously, it's a responsibility when you sign up to do something like this, but it comes from the heart. And if it comes from the heart, that means you want to do it. And so we ask, typically we're just asking for 3 hours a month. And gosh, that's really nothing. If we have plenty of providers in our area that if everyone did 3 hours, we wouldn't have enough room for them. So we really we don't want it to be a burden. We wouldn't want it to turn into some sort of volunteer burnout. We want that longevity and people to be able to feel like they're getting so much out of it. Volunteers, I mean, getting so much out of it as much as the guests are. And I think it's a win-win in that regard. Of course, I'm here to help the people, but I'm selfishly doing it for myself as well, because it does a lot of good for my heart and my soul, and growing in just so many ways. And I think, as Dr. Danaher had said, it's I live by this as well. What you're given, I think there's an expectation to give back what God has given you. So I asked that. What's surprising to me was we've had a number of younger dentists sign up here, and which is great. I really wasn't expecting that, but we have a lot of young people. We have a lot of people on the back half of their careers, and it's just great to see that wide range of volunteers getting involved. I guess what I would say to listeners is, check out your communities. Try and find areas that you could volunteer and give back to. You have so much knowledge. You don't waste all that skill to just waste away. If you are thinking about retiring, maintain your license, because you never know what opportunities may come along. And I think it's one of those things where if you just open your heart and give it a try, you may surprise yourself that how much you actually enjoy it, because it definitely is something that is out of most people's comfort zones. Everybody selfishly loves having their free time, but there's something like so valuable about making a sacrifice of taking time out of your day and adding more to your plate than you already have, in a way that that you're doing good. There's so many times where I've felt, man, I'd love to help this person out and just do this for free. And this is a place where I can do that with everyone. Especially for providers on the back half of their careers, I can't wait to be there someday, but I would think there's got to be some sense of satisfaction knowing that I'm going into work every day because I want to, not because I have to. And Emmaus Ministry, when you can come in and volunteer because you want to, not because you have to, it's a different level of care and a different level of just providing the treatment for people. And then I'll pass on to Sheila how she can how to get in touch with us. if you're interested, if you're in the upstate New York area.
So Tammie, for your audience that would be interested in volunteering at St. Mary Ann Cope Health Services, the dental days are Monday and Fridays, 10 to 1 and 1 to 4. We do have some dentists that do better with a Wednesday or Thursday. The bottom line is we're very, very flexible. If we have a dentist that reaches out and says he wants to help and he could come in on a Tuesday afternoon, then we're going to make sure that we make that happen. The waiting list for our guests is so long now, and that's kind of the sad part, is that our guests are finally seeing some sort of hope there, and now we need the dentist to be able to make that happen for our guests. The other thing they could do is to call the clinic directly, and that is 315-961-3067, and ask for Teresa. Teresa is our clinic manager, and she can kind of get you started with that. We also have a website, Emmaus, and that's EMMAUS ministry.org. And there's information about volunteering there as well. So we just continue to encourage the professionals, and this is also dental hygienists and dental assistants that want to give back to their community and feel as though they truly have made a big difference, a significant difference in the life of somebody less fortunate.
Great. Thanks for that, Sheila. Now, if somebody would just like to make a donation, how would they go about doing that?
I'll speak to that. That, again, would be through the website. There's a donation page there. The other thing would be to send it directly to the ministry, which is Emmaus Ministry. And that address would be P.O. Box 15224, Syracuse, New York, 13215.
Okay, thanks for that. And I think you obviously accept monetary donations, but you also accept supplies, correct? Like personal hygiene supplies, toothbrushes, things like that.
Yeah, so we certainly are open to it. We like to we have received generous donations from people that have retired, but we do. I'm going to say this with caution. We do vet this as well because we don't want to turn into a warehouse either. But we are totally open to people donating supplies and materials because it's. People think, dentistry is so expensive, and opening this dental up really showed me the costs involved with doing even basic bread and butter dentistry. There's just so many costs in it. And there was a joke at one point in saying, wow, the medical side, they don't need all this stuff. And the dental, like all this equipment and supplies and materials with expiration dates, it's just so much more, as the listeners would know if they're in the dental field. So we are certainly open to taking donations. We would look through the inventory because we don't want to be a warehouse, but please, if you would like to donate, please let us know and we can take a look and see if there are things that we could use. Because otherwise we'd have to go out and buy it. And we have really amazing, generous donors here, and which have helped this even get to where it's at now. And it's a tremendous cost and sacrifice of the time, talent, and treasure. And there's a lot of people with treasure that are supporting us behind the scenes. It's amazing to see everyone come together and do their part in that way.
All right, and that all makes sense. So before we say goodbye, Sheila, Dr. Danaher, Dr. Streiff, any final thoughts or any final words you'd like to share with our listeners?
I always feel so much better when I leave this place because of what we do using our talents. I am hoping that the dental assistants, the dental hygienists, and the dentists in the community see this as a sharing opportunity to the guests here at Emmaus. The most important thing is, I think, we do provide a great service, not only for the guests, but also for ourselves. There's a great feeling of self-satisfaction when you leave here. And I encourage other people to get involved. Thank you for taking the time, Tammie.
No, thank you, Dr. Danaher, and I really hope we can gather up some volunteers for the clinic. It's been my pleasure talking with all three of you, and I wish you all the best on all your endeavors, and I hope that you continue to grow your very important mission in the Syracuse area.
Thank you, Tammie.
Thank you, Tammie.
And that's the verdict on the Emmaus Ministry and all the incredible services they provide to the Syracuse community. If you're a dentist interested in volunteering at their clinic, you can reach out to the clinic manager, Teresa Metallo, at 315-961-3067, or visit their website at Emmaus Ministry, EMMAUSMINISTRY.org. The Emmaus Ministry also welcomes donations, which can be made directly on their website or mailed to them at P.O. Box 15224, Syracuse, New York 13215. Thanks for joining us today. We hope you enjoyed this podcast. Please remember to like, follow, and subscribe to our Facebook, LinkedIn, Instagram, X, and YouTube pages. This podcast is for general purposes only and should not be construed as medical or legal advice. This podcast is not comprehensive and does not cover all possible factual circumstances. Because the facts applicable in your situation may vary, or the laws applicable in your jurisdiction may differ, please contact your attorney or other professional advisors for any questions related to legal, medical, dental, or other professional obligations, the applicable state or federal laws, or other professional questions.